Good afternoon, everyone. My name is Tara, and this is the negative opening for the safe injection sites debate. In this debate, the affirmative side has argued that safe injection sites are compassionate, effective, and necessary to reduce overdose deaths. The cited studies from Canada showing reduction in overdose mortality claim that safe injection sites connect people to treatment and social services, and argue that these facilities reduce infection and other harms associated with drug use. The negative side agrees on one thing: the opioid crisis is devastating. Thousands of families have lost loved ones, and communities across the country continue to struggle with the effect of addiction. We also agree that people suffering from substance use disorder deserve compassionate dignity and support. However, the question before us today is not whether we should help people with addiction. The question is whether local municipalities ought to create safe injection sites. The negative side believe they should not. While safe injection site may appear to be a compassionate solution, they do not address the root cause of addiction. The evidence regarding their overall effectiveness remain mixed, and municipalities would achieve better outcome by investing in proven treatment and recovery service instead. My first argument is that safe injection sites do not solve addiction. Safe injection sites are designed to make drug use safe, not to eliminate drug use. Individuals bring their own drugs into these facilities and consume them under supervision. While this may reduce the immediate risk of overdose, it does not address the underlying cause of addiction. According to Garipy and colleagues, 2025, supervised consumption sites are primarily intended to reduce immediate harms associated with drug use, but evidence regarding broader long-term population outcome remain limited. Addiction is a chronic medical condition that requires treatment, counseling, mental health support, housing assistance, and recovery service. Simply providing a safer location to use drugs does not help individual overcome dependency. The affirmative argues that these facilities save lives while preventing overdose is important. Municipality must consider whether their resources are being used in the most effective way possible. Every dollar spent creating and operating a safe injection site is a dollar that cannot be invested in detoxification program, treatment center, recovery housing, mental health service, or medication-assisted treatment program. If our goal is to help people recover, then our resources should focus on recovery. My second argument is that the evidence supporting safe injection site is far less conclusive than the affirmative suggests. The affirmative cited a study from Toronto reporting a reduction in overdose mortality following the implementation of supervised consumption sites. However, one study from one city does not automatically mean the same result will occur in every municipality. According to a 2025 systemic review conducted by Garipy and colleagues, while supervised consumption sites consistently prevent overdose inside the facility themselves, evidence regarding their impact on overall community overdose mortality remain mixed and inconsistent across different locations. Garipy ETAL 2025. In other words, researchers have not reached a clear consensus that safe injection sites substantially reduce overdose death across entire communities. Additionally, the United States recently experienced one of the largest decline in overdose death in modern history without widespread implementation of safe injection site. According to the Centers for Disease Control and Prevention, overdose death decreased by nearly 27% from approximately 110,000 deaths in 2023 to about 80,391 deaths in 2024, Center for Disease Control Prevention, CDC 2025. Researchers attribute this decline to increased naloxone distribution, expanded treatment access, prevention initiative, and public health intervention. This is important because it demonstrates that community can significantly reduce overdose deaths through treatment-focused approach without establishing facilities where illegal drugs are consumed. My third argument is that municipality should prioritize treatment and recovery rather than supervise drugs consumption. The affirmative argue that safe injection sites connect individuals with addiction treatment and social services. The negative side agree that connecting people to treatment is essential. However, municipalities do not need safe injection sites to accomplish this goal. Communities can expand outreach program, establish recovery resource center, increase access to medication-assisted treatment, provide housing support, and fund mobile health services. These programs connect people directly to treatment without creating locations specifically intended for drug use. According to the Addiction Policy Forum 2025, increased access to treatment and recovery resource continue to be one of the most important strategies for reducing opioid-related deaths and improving long-term outcomes. If treatment is the goal, municipalities should invest directly in treatment. My fourth argument is that safe injection sites raise important legal, ethical, and community concern. Local government have a responsibility to provide public safety and encourage healthy behavior. The affirmative argues that safe injection sites are compassionate. We argue that compassion is important. However, public policy should not be judged solely by good intention. It should also be judged by whether it effectively addressed the problem. A policy that focuses primarily on safe drug use may unintentionally shift attention away from the ultimate goal of recovery. Finally, I would like to address the affirmative emotional appeal. The affirmative reminded us that people struggling with addiction are someone's brother, sister, child, parent, or best friend. They're absolutely right. The negative side agree that every person struggling with addiction deserves dignity, respect, and support. But true compassion means helping people move beyond addiction, not simply making addiction safer. Real compassion means expanding treatment opportunities, improving access to mental health care, supporting recovery program, increasing housing assistance, and addressing the factors that contribute to substance use disorder in the first place. We should not settle for policies that merely manage addiction when we can invest in policies that help people overcome it. In conclusion, the negative side believe that local municipalities experience an opioid crisis ought not create safe injection site. The opioid crisis demands solution that led people toward recovery, not policies that accommodate continued drug use. For these reasons, I urge you to reject the resolution. Thank you.